Exercise during pregnancy. You all know my tagline, is baby moving and grooving? How about is mom to be moving and grooving? Pregnancy, it's beautiful, awe-inspiring, life-changing. But on the flip side, there's fatigue, emotional lability, common annoyances like swollen legs and feet, back pain, constipation, etc. Can you relate? I'm sure that a lot of you expectant moms, past and present, can. So why exercise, Dr. Angela? How about because it does your body and pregnancy good? 5 reasons why you should exercise during pregnancy. Number 1, it gives you energy. For those of you that didn't get that natural pregnancy glow up, all the endorphins and feel-good hormones that are released during the course of a good workout will not only make you feel better, but you will also look better. Number 2, it keeps weight gain at bay. Remember, too much weight gain can adversely impact labor and increase your risk for things such as C-section, hypertensive disorders, gestational diabetes, etc. And just think, if during the course of your pregnancy you've been exercising, you won't have nearly as many pounds to shed postpartum. Number 3, easier labor. Remember, a physically fit mom-to-be is more likely to experience less pain during labor and maybe even a shorter labor. Keep in mind, labor means work. A fit body, thanks to exercise, will give you the power and the confidence to kick labor's tail. Number 4, exercise decreases your risk of postpartum depression. Postpartum depression is very real. Exercise will not only decrease the risk of developing this, but it will also help ensure better quality sleep, something every new mom needs. Number 5, exercise during pregnancy is a great way to just start healthy living. If you're already exercising during pregnancy, it's easier to keep it going. Remember, exercising decreases the risk of chronic medical conditions like obesity, diabetes, high blood pressure, and many others. So have I convinced you to exercise during your pregnancy? Here's what you need to know. Either continuing your exercise program or initiating one, of course after consulting with your OBGYN, will not, I'm going to say that again, will not increase your risk of miscarriage or having a baby with low birth weight or preterm delivery. ACOG, the American College of Obstetrics and Gynecology, recommends that pregnant women get 150 minutes of moderate intensity aerobic activity. And just how is aerobic activity defined? And what qualifies as moderate intensity? Aerobic activity involves the movement of large muscle groups, such as those found in your arms or those found in your legs, in a rhythmic way. So basically, moving your arms and legs in a rhythmic way. The intensity is deemed moderate if it is significant enough to raise your heart rate and cause sweating. So keep this in mind. With moderate intensity exercise, you will be able to talk normally, but will not be able to sing. Got it? A brisk walk is an example of a moderate intensity activity. Other types of exercises that are safe during pregnancy include some of the more obvious ones. Swimming and/or water aerobics, using an elliptical machine, stationary cycling, modified yoga or Pilates, jogging, and even some weight training. For elaboration on these exercises and how they are beneficial during pregnancy, please read the blog post on AskDrAngela.com. Exercises to avoid during your pregnancy. Some of these are more obvious than others. You'll want to avoid contact sports or sports that put you at an increased risk of abdominal trauma. Examples of these include things like hockey, boxing, soccer. Skydiving. You will also want to avoid any activity with an increased risk of falling. For examples, gymnastics, skiing, horseback riding. You'll want to avoid activities performed above 6,000 feet, unless you already happen to live at 6,000 feet and are thus accustomed to functioning at this altitude. Remember, always, always, always check with your OB prior to initiating an exercise routine. Certainly, if you have any of the following conditions, like a placenta previa, increased risk for preterm labor, or if you're having preterm contractions, cervical incompetence, exercise will be a no-no for you. If you decide to exercise during pregnancy, dress for success. This is not the time to go cheap on your gear. Wear comfortable, loose-fitting clothing. Make sure that you are exercising on a flat surface to decrease your risk of falling. Wear a proper shoe. This will decrease your risk of injury. And remember, drink plenty of water. One of the more obvious recommendations that I have, listen to your body. If you feel too tired, you're getting lightheaded, faint, or dizzy, either decrease your activity level or choose a different exercise. Have fun.